Welcome to Daytime Buffalo. I'm your host, Chelsea Lovell. Today we are focusing on mental wellness and ways to seek help or guidance through the tough times in our lives. Here in the Queen City, there are many organizations who offer their services for those in need. I sat down with Dr. Wendy Weinstein, a Buffalo adult psychiatrist, to talk about mental health in the 716 and how those who are looking for help can seek treatment and feel confident doing so. We're joined now by Dr. Wendy Weinstein from Bryland Behavioral System. Thanks so much for coming in.
My pleasure.
Why don't you start off by defining mental health and what it is exactly?
Mental health is the emotional, psychological, and social well-being of a person. So the short form is that it encompasses everything about ourselves.
Right.
How you think of yourself internally, how you portray yourself externally, how other people perceive you, and how you get along in the world.
What are some of the early signs that you or someone you love is struggling with mental health issues?
That question gets asked a lot, and one of the things I want to say is that it's not necessarily like worst case scenario. There can be levels. Like when someone has heart disease, they may end up with some mild chest pain. So you may notice mild changes in someone close to you. It doesn't necessarily have to escalate to like a heart attack, so to speak. So some of the things that can occur are like changes in their behavior. So if they were normally this outgoing, social, bubbly person, maybe now they're introverted. They're not wanting to go out as much with people. They're not wanting to be around people as often. Maybe if they're in school, their grades are suffering. I see a lot of people calling in sick to work, or being late to work.
And that's not normally like them.
Not normally like that. They're usually like a go-getter, wanting to get everything done.
And those are some really good signs. Now, what are some of the possible causes of mental health issues, and why are they on the rise?
It's a great question. Some of the causes are internal as well as external. There's a genetic predisposition to have some mental health issues, but there's also external. And we know in this world today that there are a lot of things that people are frightened of. And that is increasing maybe their vulnerability to become anxious or depressed.
Right.
So there's a trigger on the outside that kind of triggers the inside of the brain to snap and think, okay, I'm getting anxious or depressed now. Now, why is it on the rise? I think a lot of it has to do with education. I think people are becoming more in tune to the fact that they are aware, that they can ask for help, that they are more in tune to their symptoms. I think post-COVID had a lot to do with it. I think the world that we live in has a lot to do with it. People are more exposed to the media socially than, you know,
Right.
when I grew up.
There's a lot of triggers out there everywhere we look for someone.
Exactly.
And I really love that you talked about the genetics part of it, because there's a lot of people where you look at them or they're asking themselves, I've got everything. I'm happy. I've got things going on in my life. I've got people. Why can't I feel happy?
And I always equate that to say to a patient, you know, let's say you have everything going on in your life, but you have diabetes.
Right.
You don't think the same way. You don't think, well, my life is perfect. Why do I have diabetes? You think of it as, I have diabetes. And we have to think of that as well, because genetically, if a parent has, let's say, depression, they're at risk of the child having depression.
Right.
And so things could be going really well, but there's just that depression where they just don't feel good about themselves.
Dr. Wendy, can you talk a little bit about the stigma that comes with mental health?
There is a huge stigma. Now, it's being brought up to the forefront. So it's not like it's going to be changed in a day. It's only recently that people are starting to talk about it, so we can't expect changes overnight. And a lot of things that are being brought up, I think, make the stigma maybe worse. Like in the media, the way that doctors, psychiatrists are portrayed have something to do with it. And also, when you're depressed and you feel terrible about yourself, you don't feel like you deserve help. And so if there's this outside force that says, well, it's a stigma, that's going to delay you from getting treatment, because there's almost the stigma within you as well.
Right. And so that's what we're doing with this special, right? We're working to bring awareness about
awareness,
it, so that
how
there's
it's
not that stigma.
I always say the brain is connected to the body.
Yeah.
It's an organ just like the heart, the lungs, the liver, and it needs to be treated just the same. Even though we can't see it, it's there.
Absolutely. Now, what are some of the first steps someone should take if they're struggling with their mental health?
Ask someone that they're close with, what to do. And if they've isolated themselves and they don't feel like they have anyone, they should reach out, maybe call their doctor, maybe call, if they go to church, someone in their church, maybe someone in their synagogue, someone that is a neutral party that can understand. Because the problem with depression, when you isolate yourself and you feel bad about yourself, you kind of can push people away a little bit.
Right. Now, on the flip side, how does someone, if you notice a loved one or someone that you have a relationship with, a friendship with, is struggling or could need help, how do you approach that conversation?
You have to be gentle, because a lot of people will be defensive.
Right.
And they'll say, because of the stigma that we're trying to overcome, they'll say, nothing's wrong with me. Nothing's wrong with me at all. I'm fine. So we have to be very gentle and say, you know, I'm noticing that you're missing school, or I'm noticing that you're missing work. Is everything okay? You want to come from a non-judgmental way that says, I'm going to help you. Because part of the stigma is kind of pushing on people. You're not well, you're not doing well, you need help. And that pushes the person back further. So part of getting over the stigma is to be non-judgmental.
Right. And also, how do we kind of teach people that it's a good thing to go get help, right?
Right. It's an excellent thing, because you can feel better. You can get back to that mental health that you are aiming for. You can see that things open up for you, that where you were feeling lonely and afraid and scared, you can live life to your fullest.
That's exactly.
Yeah.
And you just kind of touched on it, but when you get that help, there's another side, right? There's the other end to the, you can overcome these issues that you're having and struggling with.
And the thing I say to people is that once you overcome that and you live this life that you never thought was possible, you have to maintain it. So it's not like one and done. It's not like I get my meds, I see my therapist, I'm feeling better, because if you stop maintenance, like if you stop taking your meds for your diabetes or your high blood pressure,
or if you overcome an injury, right? You have to go to physical therapy. You have to keep working.
And it's maintenance for your whole life, because you know that you have this, and there's nothing wrong with having it. 1 out of 4 people sometime, 1 out of 4 women sometime in their life will get depressed, and 1 out of 5 people during their life will get depressed.
Wow.
So it's on the rise.
Yeah.
It's on the rise.
Well,
yeah.
Dr. Wendy, thank you so much for coming in and talking with us and breaking down these stigmas and these barriers surrounding mental health.
My pleasure. Thank you.